It's 2:17 in the morning. You walk into the kitchen because you hear your dog lapping water over and over again. The bowl is almost empty, and when you turn on the light, you see something you wish you hadn't. The water looks cloudy. There are tiny floating particles around the surface, or there's a strange film clinging to the sides. Your dog looks up at you, thirsty and completely unaware that you're suddenly wondering whether something is seriously wrong. You rinse the bowl, refill it, and tell yourself it was probably nothing. But then you notice your dog is drinking again and again. Here's the part that matters. Something unusual in a water bowl is not automatically a disease, but a change in the bowl can sometimes be a clue about your dog's mouth, habits, environment, or health. And what you're about to reach for to clean it out may actually make the situation worse. Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian. I'm going to show you how to think about unusual material in your dog's water bowl without jumping to frightening conclusions, while also knowing which clues deserve a real veterinary examination. We'll move from the biology of saliva, bacteria, food debris, and water itself to a safe home assessment, the common mistake that can contaminate the bowl or irritate your dog, practical ways to keep the bowl cleaner, and finally, the exact signs that mean home care stops and the vet needs to take over. If you like calm, evidence-based pet health explanations that help you make better decisions before panic takes over, you can subscribe and stay with me. Let's start with something surprisingly important. A water bowl is not a sterile environment. The moment fresh water enters a bowl, your dog interacts with it. Saliva enters the water. Tiny food particles can enter the water after a meal. Dust and environmental debris can settle on the surface, and microorganisms that normally live on surfaces and in a dog's mouth can be introduced as well. Given time, moisture and nutrients can support the development of a microbial biofilm. Think of biofilm as a microscopic neighborhood attached to a surface. It isn't simply dirty water. It is a community of microorganisms embedded in a protective matrix that can make them harder to remove than loose particles floating around. That is one reason a bowl can look clean at a glance while still having a slippery or slightly greasy layer on the surface. Now add your dog's mouth to the equation. Healthy dogs naturally have bacteria in their mouths. Saliva itself is not poisonous, and a little saliva getting into drinking water is completely normal. But the mouth can also contain food debris and, in dogs with dental disease, inflammation, plaque, or infection around the gums, the microbial environment can be quite different. That does not mean you can diagnose dental disease by looking at cloudy water. You can't. The appearance of the water is non-specific, but if unusual water bowl changes happen repeatedly at the same time as bad breath, red or bleeding gums, difficulty chewing, dropping food, or a sudden change in eating behavior, the bowl becomes one small clue in a much bigger picture. There is another possibility owners often overlook. The thing you see may not have come from your dog at all. It can be a crumb from the floor, dust, hair, a bit of grass, residue from a recently washed bowl, or material introduced by another pet or by outdoor access. Even the shape of the bowl matters. Deep, narrow bowls can be harder to inspect and clean thoroughly, especially around seams, ridges, rubber feet, or scratched plastic. So the first rule is simple. Don't diagnose the dog from the bowl. Diagnose the situation by looking at the dog, the bowl, the water, and the pattern over time. Let's move to the home assessment. First, wash your hands and look at the bowl before dumping everything out. Is the material floating freely, or is there a slippery film attached to the bowl? Is it stringy, dusty, greasy, or simply made up of obvious food crumbs? Does the water have an unusual odor? And most importantly, how does your dog look? A dog who is bright, eating normally, drinking normally, urinating normally, and acting like himself is very different from a dog who suddenly drinks huge amounts of water, vomits, becomes weak, stops eating, or repeatedly tries to urinate. Here's an important myth correction. A cloudy bowl does not automatically mean worms, kidney failure, diabetes, or poisoning. Those conditions have specific clinical signs and require appropriate testing. You cannot confirm or rule them out from the appearance of drinking water. Likewise, bubbles around a dog's mouth or in the water are not automatically evidence of a toxin. Sometimes bubbles are simply produced by normal lapping, saliva, or the movement of water. Context matters far more than one visual detail. Now we get to the mistake I want you to remember. When owners see something strange in a bowl, they sometimes respond by pouring strong household chemicals into it, using concentrated bleach without proper dilution, scrubbing with a product not intended for food contact surfaces, or spraying disinfectant, and then immediately refilling the bowl. That is not a harmless shortcut. Residual cleaning chemicals can irritate the mouth and gastrointestinal tract, and some products are dangerous if ingested. Another mistake is mixing cleaning chemicals together. That can create hazardous fumes. The rule is simple. Never mix bleach with ammonia, acids, or other household cleaners, and never return the bowl to your dog until it has been thoroughly rinsed and is appropriate for food and water contact. So what should you do instead? Think mechanical first. Empty the bowl. Wash it with hot water and ordinary dish soap, using a clean sponge or brush reserved for pet bowls. Then rinse extremely well so no soap residue remains. The goal is not to create a chemically sterile bowl in your kitchen. The goal is to physically remove food residue and biofilm from the surface. If the bowl has deep scratches, cracks, damaged coatings, or areas you simply cannot clean effectively, replacing it is reasonable because damaged surfaces can be harder to clean thoroughly. And here's the satisfying part. Cleaning works because you are physically breaking apart and removing the material attached to the bowl. You are not relying on a mysterious detox reaction. Friction, detergent, water, and rinsing do the practical work. If you use a dishwasher, follow the bowl manufacturer's instructions and make sure the material is dishwasher safe. The safety rule is this: do not assume a pet bowl is dishwasher safe just because it looks like metal or plastic. Check the manufacturer's guidance, especially for bowls with coatings, glued parts, or rubber components. For the first level of prevention, focus on routine. Give your dog a clean bowl every day, and replace standing water with fresh water regularly rather than letting the same bowl sit indefinitely. If your dog eats wet food, drinks outdoors, or routinely drops food into the bowl may need more frequent cleaning. There is no magic number of washes that fits every household, because the contamination rate depends on the dog, the environment, and the bowl itself. The principle is more useful than an arbitrary schedule. If you can see residue, feel a slippery film, or smell an unusual odor, clean the bowl rather than simply adding more water. For a second level, look at the bowl itself. Stainless steel is often practical because it is durable and, when it is smooth and undamaged, relatively easy to clean. Ceramic can also be a good choice when it is intact and designed for food use. Plastic bowls can be perfectly usable, but scratches and wear can make thorough cleaning more difficult. Whatever material you choose, inspect it periodically. The safety rule is, discard a bowl that is cracked, chipped, peeling, or so deeply scratched that you cannot confidently clean its drinking surface. For a third level, pay attention to the dog rather than obsessing over the water. Check the mouth from the outside first. Lift the lips gently if your dog is comfortable, and look for obvious redness, swelling, bleeding, a broken tooth, or a very strong persistent odor. You do not need to force the mouth open or put your fingers into a painful area. A dog with dental pain may react defensively even if he is normally gentle. The safety rule is, never force your dog's mouth open, or put your fingers into an area that appears painful, swollen, or injured. And if your dog's bowl changes because he is drinking much more than usual, that deserves a different kind of attention. Increased thirst can occur for many reasons, from hot weather and increased activity to medical problems involving the kidneys, hormones, or other systems. The bowl itself cannot tell you which one is responsible. What you can do at home is observe the pattern. Is the increased drinking persistent? Is your dog urinating more often or producing noticeably larger amounts of urine? Has his appetite changed? Has he lost weight? Is he panting more? Is he taking medication that can affect thirst? Those details can make a veterinary appointment much more useful. Now for one of my favorite practical tricks. Use your phone flashlight, not to diagnose the water, but to inspect the empty dry bowl from different angles after you wash it. A thin film can be surprisingly difficult to see under normal kitchen lighting, while angled light can make residue or scratches easier to notice. Then run a clean fingertip over the surface before the bowl goes back into service. You are looking for a smooth, clean surface, not trying to identify a disease. The rule is, use the flashlight only as a visual inspection aid. Do not shine bright light directly into your dog's eyes, or use it as a substitute for a veterinary examination. There's another simple trick that can save you from unnecessary worry. Compare the bowl with the dog. If you find a strange particle, take a quick photo before throwing it away. Then inspect the dog's mouth, paws, coat, and feeding area for an obvious source. If the material keeps returning after proper cleaning, Note when it appears and whether it happens after meals, after outdoor time, or after drinking. A pattern is much more informative than a single mysterious speck. But now we need to draw a firm boundary, because some water bowl changes are not a cleaning problem. If your dog is repeatedly vomiting, has severe diarrhea, collapses, becomes extremely weak, has difficulty breathing, develops a swollen abdomen, has pale, blue, gray, or very dark gums, has a seizure, or you suspect he has swallowed a toxic substance, stop home treatment and seek urgent veterinary care. If your dog suddenly drinks excessively and is also lethargic, vomiting, not eating, or producing abnormal amounts of urine, he needs veterinary assessment rather than a cleaner bowl. You also need professional care if you see blood in the water that could be coming from the mouth, repeated nosebleeds, significant gum swelling, facial swelling, pus-like discharge, a broken tooth, obvious oral pain, or difficulty swallowing. Persistent foul breath by itself is not usually an emergency, but it is worth discussing with your veterinarian, particularly when it is accompanied by dental changes or difficulty eating. And if your dog is repeatedly producing unusual material in the water despite proper cleaning, or the change is accompanied by a clear change in thirst, urination, appetite, weight, energy, or behavior, arrange a veterinary examination. Why does the vet matter here? Because a veterinarian can examine the mouth properly, assess hydration and vital signs, review medication and diet, and decide whether blood work, urine testing, dental evaluation, imaging, or another diagnostic step is appropriate. Some problems cannot be safely identified from a bowl, a photograph, or a home remedy. In some dogs, a complete dental examination may require sedation or anesthesia, because the important structures are below the gum line and a conscious visual check cannot show everything. That is not overreacting. It is recognizing the limits of what you can safely see at home. So let's bring this all together. If you see something unusual in your dog's water bowl, don't panic and don't immediately reach for a harsh chemical or a supposed detox remedy. Look at the material, look at the bowl, and look at the dog. Clean the bowl thoroughly with a sensible method, replace damaged bowls, keep fresh water available, and watch for patterns in drinking, urination, appetite, energy, and oral health. Remember the biology. Saliva and environmental debris can introduce material into water, and moisture can support biofilm formation. But the appearance of the water is not a diagnosis. And I want you to remember something else. Cleaning your dog's bowl and paying attention to small changes is not being paranoid. It is responsible pet ownership. But responsible ownership also means knowing when observation has reached its limit. Calling your veterinarian is not a failure to handle things yourself. It is often the smartest next step when the signs point beyond routine hygiene. Now I want to hear about one specific detail from you. When you first noticed something unusual in your dog's water bowl, what did it actually look or smell like? Was it cloudy, slimy, full of crumbs, had a strange odor, or did you notice something floating in it? Tell me what you saw and whether your dog was acting completely normal at the time. I read every single comment, and those real-world details help me understand what pet owners are encountering at home. If this video helped you replace a scary guess with a calmer, safer way to assess your dog, give it a like and subscribe. And if you know another dog owner who might panic the next time they see something strange in a water bowl, share this with them. Sometimes the most useful pet health advice is not a miracle trick. It's knowing what you can safely handle at home and recognizing the moment when your veterinarian needs to step in. I'm Dr. Ryan Scott, your neighborhood veterinarian. Stay safe, and I'll see you in the next one.